SnapFlash fam. Big political drama is unfolding in Botswana. President Duma Boko has declared a public health emergency, but the opposition says it's nothing more than a power grab. So is this about saving lives or seizing control? Let's dive in. Did you know this emergency declaration could give government access to workers' pension funds without the usual safeguards? Stick around, because the details will shock you. Before we break it down, hit subscribe and ring that bell so you never miss the stories mainstream media doesn't unpack. Let's get into it. On August 25th, President Duma Boko invoked Section 17(1) of the Constitution, giving himself sweeping powers to act quickly as Botswana's health system buckles under medicine shortages and collapsing hospitals. Boko says the declaration is needed to fix supply gaps and speed up interventions.
The first step is ensuring that there is an immediate alignment of all legal and regulatory instruments to ensure that there exists no legal or regulatory impediment towards the mobilization of required resources to address this emergency. As such, by the powers vested in me by Section 17, subsection 1 of the Constitution of this Republic, I hereby declare a state of public health emergency, granting me the necessary powers to make decisions quickly to address the immediate medical needs of the nation. In addition to this declaration, I hereby set aside Clause 34, Subclause 3, A and B of the Retirement Fund Act 2022 to enable the establishment of the Health First Botswana Partnership, a 5 billion Pula fund to which the Botswana Development Corporation shall invest the initial sum of 100 million. The purpose of the fund is to facilitate strategic procurement of healthcare supplies to adequately support the public health system's needs, to align procurement activities with the Ministry of Health's comprehensive plan to ensure timely delivery of medicines, consumables, hospital machinery, and spare parts, to establish and strengthen global partnerships with reputable manufacturers and original equipment manufacturers, OEMs, to secure high-quality products at competitive prices, to implement streamlined procurement processes, including transparent bidding and contract management to enhance efficiency and accountability, to invest in capacity building for procurement personnel to improve negotiation skills, management and compliance with international standards. It will also incorporate sourcing strategies that prioritize local manufacturing and sustainable practices to boost the domestic health sector and ensure long-term availability of essential supplies.
But the Botswana Congress Party isn't buying it. They argue this is less about health and more about power. In a fiery statement and a Facebook video, the BCP accused the government of abusing the Constitution to expand presidential authority. They claim existing public procurement regulations from 2023 already allow fast-tracked medical supplies, meaning this crisis isn't about laws, but about, quote, leadership failures, corruption, and misplaced priorities. Here's where it gets explosive. The BCP warns the declaration allows government to suspend Section 34 of the Retirement Funds Act. That could open the door to dipping into workers' pensions without the usual protections. The party says this puts ordinary people's retirement savings at grave risk.
Botswana beso, roterentse re tshwenyegile ka seemo sa lethoko la melemo go dikokelong bogolo jang dikokelo tsa puso. Botswana Congress Party e ne ya ntsha laetsa ya ntsha lentswe e ikuela mo pusong go tsibogela se se iragalang ka boheu. Re itumella go bo puso jaanong e lebega itsibogile melemo e goroga batho ba ta kgona go bona botshelo seo ra se lebogela re le Botswana Congress Party mme re kopa go supa seo seo ga re bua re re a re tseng mathata a botsogo e le mathata a tshoganetso gone mo ga go reye gore go e go molao motheong go e go twe declare state of public health emergency dio tse pedi tseo ga di tshwane potso ke gore a tse dintseng di dirwa a di ne di ka dirwa go sena declaration of public health emergency karabo ke di ne di ka dirwa molao wa leta gore go ka rekwa melemo go ba ile gore ke bone ba dira melemo direct procurement from the manufacturer molao wa leta go mo a molao wa leta go ka irwa komiti ya ka e dirilwe go sena declaration ya ka president a dirile molao wa leta la gore tautona ka ba le koko le tla le no ka metse sone se a molao wa leta gore dikoloi tsa masole di ka tsana di sureleditse melemo go di kgaolo molao wa leta potso ke gore ya nong go tsena ko molao motheo re be re ya no re batla gore re dirise molao motheo go hata utona dithata re mo hadihi tsa sena natso mo nakong ya gompieno ra tshwenyega re le Botswana Congress Party ha go iwa ko molao motheo go ipha dithata ka gore re ba le badi ra itse sene sa iragala mo nakong e hitileng ha go iragala yana go ra gore ga go sala morago di tsamaiso tse ile gore di tshwanetse di ka moso batho ba rabela tse ba di dirileng ga re dumalane le go dirisa molao motheo go ipha dithata tse di sa tlhokagaleng ka gore tautona o na ntsana le dithata a re a kweleng melemo ba sa tsogang sentle ka keo ya goroga ke a leboga.
Critics say the UDC-led government ignored health experts for months, poured money into perks and political patronage, and only acted when the system nearly collapsed. Citizens online are also calling foul, accusing government of using emergency procurement as cover for corruption.
Kana how tsama o ba pilele tsotsi ga wa tshwanna go bonya ka gore ga o ka bonya wa jeo for 58 years domkara ga entse re ka melemo high school re ba domkara ga isna gore ka melemo e be re bona o pa ya ko television ya gore bolela gore melemo ya emela bosigo e be re simolla re duduetsa ka gore ga re go tlhopa re re tsa o busele hatse re go tlhopela gona gore o dire dio tseo so ga ra tshwanna go galletsa dio tse ileng gore re go tlhopetse tsone gore o di dire ga o ya ko ATM wa go ntsha madi kana o romeletse e-wallet madi ao ke a gago ga se ya ATM ebile ga se sekolo ATM ga ya go adime madi ga e ka gore go tswa ho o bo simollo ga laletsa ATM gore ATM e nnetse madi e tshwanetse go nela madi ke madi a gago jaanong state of emergency sa health o tlo bona o ditsotsi gore di bereka ya ba khama melemo ga ba reke melemo gore melemo e be e hela ha melemo e sna go hela ya no ba tlabogile ba re he melemo ke e di traka di a emella it's a situation they created deliberately gore e be le ba galaletsa le re ya no melemo e teng ya emella ka di traka e bile tla bo etsa mae ka tilo ke masole no. We should not have been in that situation. That's a situation they created. Why did they create it? Yang by the state of emergency sa health. State of emergency sera gore yang di tender tsa go supply melemo. Ke tsa bone, le ditsala tsa bone, le masika a bone. Ba le nosi ka gore yang ho laola ha bona le state of emergency. Ho laola ene tauto. Yang banna ba ba lemoga gore 2029 o ka nna ska ba tsamaya sentle. Ba batla gore pele ga 2029 kana ga 2029 a tlo goro ba humile le di millionaire o nang le bana ba ba bedi o batla gore bana ba botlhe e be le di millionaire o nang le bana ba le batlhano o batla gore bana ba batlhano ba be le di millionaire o nang le bana ba le 14 le eno o batla gore bana ba le 14 e be nna di millionaire ya no wake up Botswana elandi tsotsi tse tlhoko ka gore ga le sa ba ile tlhoko di tle gore perhaps ya lebo.
Instead of shortcuts, the BCP wants the government to partner with international bodies like UNICEF and UNFPA to procure medicines transparently, and to push for real healthcare reforms that fix the system long term. So here's the question. Is President Boko's emergency declaration a bold move to save lives or a dangerous political overreach that risks people's pensions? Drop your thoughts in the comments. We want to hear from you. If you're finding this breakdown useful, smash that like button and subscribe to SnapFlash. Your support keeps us exposing the stories behind the headlines. For now, Botswana is caught between hope and suspicion. Will this emergency bring medicines back to hospitals or fuel another cycle of political controversy? We'll be tracking it every step of the way. Stay tuned, stay sharp, and as always, keep questioning.